Hello, I'm Dr. Christopher Kramer, and I'm here with Dr. Igor Klem from Duke University, and we're going to be talking about the study that he's publishing in JACC Cardiovascular Imaging on the use of cardiovascular magnetic resonance stress imaging in women. So, Dr. Klem, why don't you tell us about the findings of your study?
Well, this is a study where we looked at 147 women who were referred for a diagnostic X-ray coronary angiography because they had symptoms of chest pain or other symptoms suggestive of coronary artery disease to look whether this is the cause of their symptoms. And we recruited them prospectively, and they all underwent a multimodality cardiac stress MRI test.
Can you describe the protocol that you used?
Well, the CMR stress test is composed of a cine MRI test at rest to look for resting wall motion abnormalities, to look for the size of left ventricular chamber, and so forth. Then we slide the patient out, apply adenosine, which is a vasodilator, for about 2 minutes, then place the patient back into the scanner bore and acquire stress perfusion images, which takes about 2.5 to 3 minutes for the test to be completed. Then we have an interval of about 10 minutes where we wait for the contrast to wash out, perform a rest perfusion study, and following that we acquire delayed enhancement MRI images for assessment of myocardial infarction and scarring. The entire test takes about 45 minutes for the patient inside the scanner.
Good. And why did you just decide to focus on women?
Well, you know, women are a very interesting patient population. We know from previous experience with non-invasive imaging in women that there is a reduced sensitivity and specificity for detection of coronary artery disease. However, when we look at the mortality data, we notice that coronary artery disease remains the #1 killer in women in the US and worldwide. So we wanted to see whether MRI can provide here some additional benefit for the diagnosis of CAD in this population.
And how did stress CMR fare in its diagnostic accuracy?
Well, the primary results, taking into account the entire patient population, we found a sensitivity of 84%, a specificity of 88%, and an accuracy of 87% for the detection of coronary artery disease. And we also looked at some of the traditional limiting factors for stress testing with imaging, which is looking at patients with a small heart size, limited disease, and intermediate grade stenosis. And we found that all the women who had multivessel disease, left main disease, were identified correctly. 6 women who had a single vessel disease, coronary involvement, were not detected by the combined MRI test. Similarly, the test sensitivity goes down in women who have small heart size, and that may relate to a more technical reason, actually, that you have oftentimes women who have larger breast circumference and tend to have smaller heart size. We have to choose a larger field of view for our imaging, and we have just a limitation in the spatial resolution.
Any other pitfalls in using stress CMR in women?
Well, the test was completed in 136 of the 147 women that we enrolled, and the reasons why tests were not completed were, first of all, MRI related. If the MRI protocol was malfunctioning, that occurred in only 1 patient. Only 1 patient had a severe dyspnea due to adenosine, but the test could be completed. And the other reasons that led to test results that could not be included are that we could not get an IV access line, or patients had coffee in the morning of the test, and similarly reasons.
So where do you think stress cardiovascular MR fits in the overall armamentarium of non-invasive imaging and detection of coronary artery disease in women?
Well, I think from this very limited experience in 2 centers, we can certainly say that there is some utility. We have acceptable results for the detection of coronary artery disease. I would say that there is further studies needed to corroborate these findings and test it on larger multi-center basis.
Thank you, Dr. Clem. And thank you for watching CVN. We hope you found this interview of interest in learning about the detection of coronary artery disease in women using cardiovascular stress magnetic resonance.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.